Good morning, everyone. We will start in the next 2 minutes. We're still waiting for more people to join in, and then we'll start at 5 past. Thank you. Okay, I think we can start. Do this. Okay. A very warm welcome to everyone here for this seminar series. Good morning, afternoon, or evening from where you're joining us. I am more than grateful to be launching this seminar series on querying social survey research, reimagining the measurements of sex, gender, and sexuality in Africa. My name is Thembiso Mkhize, and I am a junior researcher at the Gauteng City Region Observatory, also known as the GCRO, and I am the project leader for querying social survey research. I will be the chair for today's discussion, and I shall be taking you through the program of today's seminar. So just to give you a little background about this seminar series. So the GCRO, in collaboration with Social Impacts Insights Africa and the Center for Sexualities, AIDS, and Gender, we organized a 4-part online seminar series to establish the importance of nuancing the measurements of sex, gender, and sexuality in social survey research conducted in South Africa. So the seminar series was motivated by the growing recognition to explore approaches to tackling the measures of sexual orientation and gender identity. And as we all know, that the society is slowly becoming more accepting of LGBTIQ plus individuals in Africa, including South Africa. However, we see that social survey research continues to reinforce the invisibility of the LGBTIQ plus population. by not measuring their existence or not doing so adequately. Although social survey research can help in increasing the acceptance and the inclusion of LGBTIQ plus people in society, the way it has worked in the past and recently has often undermined the lived experiences of LGBTIQ plus population. And we see that quantitative research instruments have been structured to ignore the existence of any gender identification other than male or female or men or women. And sexual orientation and gender identity have remained the two demographic variables that continue to receive relatively little attention in large-scale social surveys and official statistics. And this means that LGBTIQ plus individuals will continue to be a hidden population when it comes to policy and planning in South Africa. So while we are all aware that good policies makes good research makes good policies, this seminar series and the work that is being done on the entire projects, we aim to fill the unique void in statistics, research, and policy on LGBTIQ plus population. And we aim to contribute to the efforts of restructuring social survey research so it accurately captures the complexities of the entire population. So today we are joined by 4 amazing experts who will share their insights on the importance of collecting sexual orientation, who will share their insights on the importance of collecting data on sexual orientation and gender identity, and they will share their views on the dangers of ignoring sexual orientation and gender identity variables in social survey, and they will also help us understand the disciplinary lenses in relation to queer spectrum data, and they will also share their views regarding data gaps on the LGBTIQ plus population and the impact this has on policy. So before I call the speakers to share their insights, I would like to acknowledge everyone involved in the planning process and the implementation process of this seminar series. This includes my former colleague, Dr. Julia Descartes, who helped me shape and build the argument for this project. I'm wondering if Julia, can you please just turn your camera on so that people can see you? Thank you. And I'd also like to acknowledge the partners for the seminar series, which is Dr. Tara Posa Ngwado and Pierre Broward, who also helped build this the program for the seminar series and the objectives. And I'd also like to acknowledge the GCRO Management Committee and my colleagues, Naledi Ngwenya, Melinda Swift, Vuyiswa Mkhwanazi, and Lid Davis for all the logistics support. So now I would like to invite the collaborators to just introduce themselves, and then I will hand over to Naledi, who will take us through the rules of engagement for our session today. Then after, I will proceed with the program. Tara and Pierre, can you just introduce yourselves, and then yeah.
Okay, thank you. Not much to say, but just such a great appreciation to be part of this wonderful project. I've been doing social survey research for about 20 years and I'm incredibly looking forward to learning from all of you. So thank you, Sthembiso.
I'm Pierre from the Center for Sexualities, AIDS and Gender at the University of Pretoria, and delighted to be here. Thank you.
Thank you, Tara and Pierre.
Morning, everyone. My name is Anthony Brown, and I'm with the University of Johannesburg in the Faculty of Education. I don't know whether I had to come through now as well, but yeah.
Thank you, Anthony. Okay, Naledi, can you just take us through the rules of engagement, and then we'll just proceed with the program.
Okay, greetings, everyone. My name is Naledi Ngwenya from the GCRO, and I'm the administrative officer. So I'll be quickly just going through today's house rules. So please note that this session is being recorded and will be shared or uploaded to our website for public dissemination. If you have any concerns regarding this, please write me privately. Our conversation today deals with areas of sensitivity and the lived experiences of the LGBTIQ+ people. So we encourage people to create a safe space and note that it is okay to ask questions if there's anything unclear, and it is also okay to have viewpoints, but we appreciate that everyone is respectful of other people's views and experiences. This seminar series is not an attack to any organization, and we would appreciate that people are mindful of their language, practice respect, and be open-minded and unbiased. We acknowledge that some content may be triggering or against your own beliefs, but please feel free to write to me privately, and we will happily provide resources if needed. Please ensure that your microphone is on mute unless you are unmuted by the chair to participate in the discussion. Please use the chat box to write your questions or any comments to the speakers. If you would like to contribute to the discussion, please click on the participants icon and select raise hand, which will alert the chair that you would like to make a point. Please share your name and affiliation after the host has unmuted your microphone. Please select lower hand once you have spoken and your microphone will be muted. Now we'll hand over to Sthembiso, who will take you through the rest of today's session. Thank you.
Thank you, Naledi. So before we begin the presentations, we've created a short survey to give everyone an opportunity to share their insights and views on the inclusion of sexual orientation and gender identity questions in social survey development and implementation. I will just share the link on the chat box, and I will kindly ask everyone to respond to these questions. It will take about 5 to 7 minutes to complete. The survey will help us on writing up a provocation after the seminar series, and the provocation aim to challenge the conventional understandings, stimulates new thinking, stir up debates, and incites readers to respond with interpretation of their own, and it will be shared with government and everyone that is joining us today. So I've shared the link on the chat box. So can we just take 5 to 7 minutes just to complete, and then we'll proceed with the program. Please do let me know if you face any challenges with completing the survey. Okay, so while people are completing the survey, I will call upon our first speaker to share their insights and their views based on the question of the day, which is, why is LGBTIQ plus inclusive data collection important, and what are the risks and implications of not having such data? So I'll call on Rochè Kester, who's a director of LGBTIQ plus desk at the Gauteng Provincial Government Office of the Premier, to just take us through her insights. I will give each speaker 10 minutes to present their views, and then we'll proceed. Thank you.
So good morning, everyone in the room. I'm so happy to be here and to be part of this conversation. For myself, in terms of the question, I think we have to also just be cognizant of the fact that last year, when there was a call out, or a rather, let's say, we were made aware that there was going to be a census and LGBTIQ plus A persons weren't included. A lot of activists, a lot of civil society groups had said that this was a complete missed opportunity, and rightly so. And for that reason, I want to put into context from a governmental perspective why it is a missed opportunity. So currently, as the Office of the Premier and our LGBTI Directorate, one of our duties is to ensure oversight of government programming in terms of government service delivery, and we do this with all provincial departments. And so this is a very new thing for a lot of government departments, because some of them have never, for instance, factored in LGBTI programming. Certain departments are ahead of the curve in this regard, like the Department of Social Development, Community Safety, and then also, to a degree, education as well, but more on a national basis. And I'm sure that Professor Anthony Brown will speak more to that. But like when we look at something, for instance, like Treasury or Road, Transport and Safety or Department of Infrastructure and Development, there's very limited, let's say, actual programming that works. So within government, each department creates what we call an annual performance plan. And on these plans, there are dedicated indicators as to what you are supposed to be achieving throughout the year. So of course, this becomes problematic then for LGBTI persons when they don't appear whatsoever on any of these plans. And so what we've been doing as the LGBTI Directorate has been to engage government departments to say, okay, how do we then look at what the needs are of LGBTI persons, and how does it apply to your department? How do we fill those gaps, and how do we concretize it to ensure that this is included in what you are supposed to do, but also that it's monitored and evaluated? And so we've embarked on a conversation in terms of conversations in bilateral meetings with departments to address this very issue. One of the things that is most, well, that intrigued me the most about the programming, specifically in terms of let's say disaggregation, was that there was a very specific focus on women and persons with disability. Almost in every departmental plan, there is a percentage that that deals with various things. So let's say, for instance, just employment, for instance, and we'll say, okay, at senior management level within government itself, there needs to be, let's say, 40% coverage of the employment of women, and similarly, let's say 10% in terms of persons with disabilities. So this then begs the question: how do LGBTI people fit into the conversation? And we have to put it within the context of looking at persons with disabilities and women as well. The reason why these groups are specifically demarcated and targeted for specific programming is because they have been marginalized, or they have been, they are vulnerable population in society, or they've just experienced measures that don't speak to equity and equality whatsoever. And I think when we look at it from that lens, we then have to also say, well, you know, given the history of our country, given that there was a criminalization in South Africa of LGBTI persons, and all of the legislative work that has then gone into undoing that, there's still a means of necessary implementation that speaks to service delivery of LGBTI persons. And so for this reason, I think it's important that we gather and do this research. When I've engaged with government departments and I've said to them, okay, but how do we then ensure, okay, the employment of LGBTI persons within economic development, for instance, or how do we ensure that procurement makes provision for LGBTI persons as service providers? And so the continuous conversation and the feedback has been, well, we don't have the data, and in order to ascertain numbers or percentages, we need to then do the research. And within government, that's pretty much the framework. If you don't have hard statistics, you can't necessarily ensure that there is going to be programming for this group of individuals. And so it becomes also then very difficult, because in terms of LGBTI research in general, a lot of the research has been very qualitative. So open-ended questions in terms of how people experience things versus a very hard data that can be used as a measure, you know, to show the disparities, or rather the marginalization that the community endures. So I would say, for instance, one of the times that it was very beneficial, and the statistics that they were hard statistics was in a study that was done in 2016 by what was then known as the Love Not Hate campaign. And it consisted of various civil society organizations in various provinces. And they literally interviewed LGBTI folk to measure the types of hate crimes they experience, the frequency of hate crimes, the demographics of the individuals in terms of age, and also race. And so that data was then used as a tool to ensure that government programming in terms of the prevention and combating of hate crimes exists in South Africa. And ultimately, we want to get to the same point within each department within government programming. Just speaking to, for instance, the departments that I have mentioned that are a bit more progressive. Social development has really beyond, you know, service delivery, but just in terms of awareness, they have taken initiative in celebrating things like Ida Hobbit, the International Day Against Homophobia, Biphobia, and Transphobia. They've also embarked on Orange Day, which happens the 25th of each month, and it's basically a statement against, you know, violence in general, and they've included the LGBTI directors to be part of these conversations. But then also they've got a specific indicator that speaks to psychosocial support, and you know, the target is then 50% of people need to be reached through this measure of psychosocial support. And we know that mental health issues in the queer community is very prevalent, you know, in terms of just body dysmorphia, issues of suicide ideation, depression in general. And this is obviously influenced by a number of factors that affect individuals specifically in their lived reality. But then the question begs, and what I've discussed with social development, is then how do we make the public aware that these services, number one, do exist, and how do they access it? Because if this exists and you are not meeting your targets, that means you do not have a strong accessibility to the community to ensure that they also are aware of this. I also wanted to speak to, just also something like community safety. And we know that we've got the National Strategic Plan for against gender-based violence. And in the plan itself, it's very dominant that LGBTI persons have to be serviced in relation to, women and other vulnerable persons like children. But then in how this is implemented is a different story. When we speak about GBV, sometimes and most often LGBTI persons are left out of the conversation. And so hate crimes as a form of gender-based violence doesn't even, fit into the conversation, and you have to constantly explain why it is a form of gender-based violence, but also then speaking to things like services like in relation to intimate partner violence and domestic violence, and not just in the sense of a romantic relationship, but also cohabitating children with abusive parents and what that looks like. And so within community safety as well, although the programming exists and there's a very fervent stance of things that they need to also achieve within the department in terms of the prevention and also the action to violences that are perpetuated, the amount, or let's say the streamlining or the mainstreaming and the targeted programmatic activities toward LGBTI persons is not really something that exists. And of course, then again, it begs the question, if you don't have the statistical data of how many people need to be serviced, how do you create those services and how do you access the community? I also just wanted to speak to the risks of not being able to do this. So ultimately, in the work that we are trying to achieve as the LGBTI Directorate in the Office of the Premier is to mainstream LGBTI issues in general, and then look specifically at these plans, see how we can implement programming, service delivery, but also being very deliberate in targeting groups and ensuring that there is a certain amount of individuals that are reached through this work. And so if we do not have statistical data, and if we do not have quantitative data, it becomes really difficult to consistently justify the need for programming. I would give you an example, just looking at our health, the Department of Health. We know that, for instance, with HIV and AIDS programming, MSM and then also transgendered individuals are looked at as key populations, right? And a lot of data and research has gone into that. But it also creates then a neglect for the rest of the acronym. When we speak about trans individuals and just their access to hormones and stockouts that occur on a governmental level in hospitals, that becomes a different conversation than just the analysis of being a key population in terms of HIV, because that's a different kind of health service that is needed. If we speak about the disaggregation, or rather even just sexual reproductive health of lesbian and bisexual women, knowing, for instance, that condoms are freely available in the country, but like things like dental dams and finger cots are not as freely available, and people have to do that or buy it privately. And so we need to get to the point where we have hard data, hard facts, so that these things then become very let's say obvious as to why, if we have this contingency cohort and constituency of people that are in need of these services, it becomes way easier to ensure that there is a obligation from government to ensure service delivery for these individuals, instead of just talking about what the needs are. It would lead to then a concretization of, these are the numbers, this is how we incorporate and target these groups, this is how we monitor and evaluate the impact of these services that we are trying to provide to these individuals, and also see if these targets are actually met. At the moment, it becomes very difficult since we don't have that data. But this is definitely something that in general that we need to be thinking about. And I see you, Stimpy, so I just have one more thing to say before I depart. Also, just in terms of administrative violences in general, the statistical data will then ensure that even when you apply for a job, currently on Z83 forms, for instance, from a government perspective, is still binary. There's female and male, which is actually a sex descriptor and not actually an indicator of gender identity. But if we move toward, this inclusivity counting and numerizing, the amount of people that identify as non-binary, women, men, gender non-conforming, this becomes a different kind of way to also ensure that the administrative violences that exist, for instance, in terms of like binary bathrooms within programming like in DID, that this is minimized because we have that data. So I hope I was able to give some insights as to how the overarching needs of LGBTI people become very minimalized when we don't have this data, because we need research and we need facts and we need quantity to ensure that there is a definite targeting of services. Thank you so much.
Thank you so much, Rochè, for your inputs. I believe that your input sort of reminds us how a persistent lack of routine data collection on sexual orientation or gender identity remains a challenge, a significant challenge for policymakers, researchers, service providers, and government departments, advocates seeking to sort of improve the quality of life and well-being of LGBTIQ plus population. Thank you. So I will now call upon our second speaker. But before I do, I just want to remind everyone to just pop in your questions or comments on the chat box, and we will answer to those after all speakers have shared their insights. So I'll call Professor Anthony Brown from the University of Johannesburg. Thank you.
Good. I think it's still good morning. Good morning, everyone, and thank you so much for this opportunity. I think Rochè has captured it quite well to discuss the importance of survey research. And I want to latch on to what Rochè has said. It is a missed opportunity, but part of that missed opportunity is slightly bigger for me. It is the issue that this is an exclusion to citizenry. So when we look at the issue of census and the LGBTIQ plus community being excluded from such critical information and data collection, we exclude them from their constitutional rights to be considered to what they are entitled to, how services should be delivered, what services should be delivered, and that to me is the biggest issue. It is from a constitutional perspective that we are infringing on their rights. We are trampling on the rights of the LGBT community if we do not include them in such national data collection processes that influence one, public policy, it influences delivery of services, and it also influences how to create inclusive and safe enabling environments as a citizen. And so that to me is a challenge. And it is another thing that I wish to touch on is that we have become stagnant with the Constitution. We keep on celebrating the South African Constitution, but this particular document does not translate into further development in these other core delivery services, core elements of policy development. And so those who are in need and perhaps most vulnerable for this need are then not catered for. My work is particularly within education. And I'm looking at care and support, the teaching and learning, care and support for learners with diverse sexual orientations and gender identities. And the problem with the schooling system and not having a large data set is that the school system is very heteronormative. Many of the policies, many of the services and the provisions within a school context has been developed for a cisgendered heteronormative context. And we know we have diverse learners with diverse sexual orientations and gender identities. So there's a problem with this. First of all, when we think of this large data that we do not have, research of this magnitude, or let me rather start with this. We have a growing interest of research in sexual and gender diversity education within the schooling context. However, this is small scale data. This is data that's been collected by a researcher who shows interest or a scholar who shows interest in this area. It is a dissertation, it's a thesis that often collects dust on a shelf somewhere in a library. And so we do not have large scale data that we can pull from to inform the education system. And now, because we deal with diversity of parents, we receive a lot of resistance. When we try to introduce and improve education that is inclusive of SOGI identities, we find that there are pushback groups who are asking for the data. And we do not have this data to say, this is the number of cases of gender-based violence that we have experienced in school on the basis of SOGI identities. Just a month ago, as you would be aware, we had a learner who committed suicide based on comments from a student teacher. But our learners are subjected to this kind of violence on a daily basis, but we do not have this kind of data that would inform educators, teacher education institutions, the ministry or the Department of Education to develop policy, strategy, and support mechanisms to create a safe and inclusive learning environment. We were fortunate to have partnered with a number of civil society who are creating care and support opportunities and for diverse learners with diverse sexual orientations and gender identities. And they fed the department with this information, and this information enabled us to develop guidelines for the inclusion of SOGI identities within a schooling context. We are almost at the end of this journey, but this is the kind of importance of data and what data can do. But in the absence of that, it is difficult because we need to bring the evidence, we need to bring the facts, we need to bring the statistics that shape and influence policy development, service delivery, and care and support strategies within certain sectors. Let me just see what else I have here. There is a problem for us, particularly in education. How do you engage with young people with large data? Before young people can participate in research of this magnitude, we need to get consent from the parents. So not only is it a matter of large data, but it's also the processes in getting this valuable information from our young people, because there's a policing. My child will not participate in this research. And we need to think strategically, we need to think very hard how we can then develop large data sets within certain contexts, which is controlled and policed by adult bodies. A last thing that I've also made notes on was the IMES systems. How could we use IMES systems, education information management systems, to integrate SOGI information? our school, for those who have children at school, you would know when children apply the application document, it's very heteronormative, but there is an opportunity that it does not even have to be research-based, but just these formal documentation could integrate already elements of SOGI-esque identities that will enable us to understand who are our learner cohort, or who are our cohorts in various sectors, be it health, be it economics, be it schooling, but how can we use information management systems to capture information that is related to SOGI-esque identities? Let me stop here. Thank you so much, Thembiso.
Thank you so much, Prof. Brown. Thank you so much, and I think your contribution reminds us how various sectors continue to be accommodating to people who are heterosexual, and it also reminds us that inclusion matters, and the importance of how evidence-based research is sort of important to sort of influence policy development. So thank you so much for your contribution. We have a question, but we will attend to all questions at the end. Now I will call upon Cassandra Roxburgh, who is a trans feminine journalist and an associate editor at Minority Africa. Thank you.
Thank you so much, Thembiso. A note on the surname pronunciation, it's Roxburgh, bane of my childhood to get that mispronounced, but blame my Scottish father. Thank you so much to GLCO for hosting this seminar on a very, very critical but often overlooked topic. I think the point of departure that I really want to start with is why demographic data is so important. It's this kind of essential thing that most sectors of society rely on. And, you know, on a daily basis, we interface with countless systems that are shaped by data collected by corporations, by government institutions. Every ad served to you on social media is aggregated from demographic data that's being collected. The policy decisions about how many, you know, clinics and hospitals there are in your respective suburb is shaped by the demographic data that our government collects. And there's a lot of resources that some of us might take for granted, particularly, you know, cisgender heterosexual bodies and white bodies, you know, having doctors that don't discriminate us, being able to have the correct information on our ID books, or even just being able to access necessary healthcare without spending thousands of rands a month or traveling halfway across the country just for the chance to see a doctor. And I kind of want to flip the script a bit and ask all of you just to imagine not being able to access those resources. Imagine knowing that if you want to go get necessary healthcare, you potentially going to deal with being discriminated against by doctors, or spending a lot more money than you can actually afford to get critical life-saving surgery, or, as the situation currently stands in South Africa, particularly with trans-affirming surgery, is to potentially never get that surgery unless you can afford private healthcare, because we have exactly one doctor that provides those surgeries. And that's kind of a reality for a lot of trans people and a lot of queer people in South Africa. And it is largely perpetuated by our sociocultural norms, but also a lack of inclusion in social surveys. When it comes to the question of medical access, we have 6 facilities in the whole of South Africa that provide gender-affirming healthcare, that are state hospitals. That there's some additional clinics and whatnot, thanks to My Sexual Health and the WITS RHI program that also provide these services, but these are largely clustered in urban areas that can often be incredibly inaccessible to people. And that's largely informed by the lack of data regarding trans healthcare and regarding the amount of trans people we have in South Africa that informs our kind of policy decisions from the government. And as a trans journalist who predominantly writes about trans liberation in South Africa, I often get asked these kind of gotcha questions about, oh, where is the data to support your arguments about the medical field being incredibly transphobic, or, you know, trans people being disproportionately targeted by police brutality and homelessness and stuff like that. And it's a difficult question to answer because we don't have, you know, accurate surveys dealing with that. Our best data on the socioeconomic status of trans people and, you know, public perceptions of trans people is a report from an American institution, the Williams Institute report, surveying a couple thousand people in urban areas. And that's the best data we have on trans demographics, you know, in South Africa. And when it comes to the broader queer community, it's not any better. And these reports, you know, do make some very valuable insights that we can use to inform how we target policy and stuff like that. Like half of healthcare workers, you know, believing that, you know, trans people shouldn't do what they do. You know, men shouldn't wear dresses and vice versa. And, you know, there's a third of our population that believes that trans people shouldn't receive legal protections. And these are good statistics, but, and, you know, there is always a but to these. We can't use that data to estimate the size of the transgender population in South Africa. We can't use that data to estimate the size of, you know, the broader queer population. You can't, you know, say, oh, there's this many lesbian, gay, and bisexual women living in this area, and, you know, so we should provide better, like, resources for support to them, particularly with the pervasiveness of corrective rape within a large part of our country. And, you know, a lot of people ask these questions, you know, they're doing this kind of bad faith gotcha moment of, oh, you don't have data to support your argument. Well, you know, that's a sign that queer issues aren't as important as corruption or the energy crisis, which, you know, are all incredibly important problems, but I don't think we should be doing this kind of totem pole hierarchy of what matters more. That's not how a progressive society founded on human rights functions. And I always like to invite people to consider why we have no statistics and why this is actually an indictment of broader, you know, departmental failures. And I'm not trying to attack any government departments, but it was a missed opportunity. They have had like 2 decades to add these kind of questions to our censuses, and they haven't. And, you know, we can only hope that they move forward from that. And we should really be questioning why this gap exists. You know, is it ignorant? Is it ignorance? Is it apathy? Is it generic queer phobia? You can, like, make your mind up there. I lean in favor of just ignorance. That's kind of how our society tends to function. And I guess to the broader question of why it's so important to have these queer inclusive social surveys, I think the really simple answer is that if we want to be viewed as a progressive and inclusive society, you know, we like to brag about being, you know, so queer inclusive and being the queer haven of Africa when, you know, that's all good on paper, but in reality, we don't sort of make that apparent beyond, you know, courting the dollars and pounds from wealthy queer tourists. That's a whole different discussion to be had, though. And, you know, just with the way things are progressing in our society, it's becoming more and more apparent that we need to have high quality data on gender identity and sexual orientation of people in South Africa, particularly when it comes to trans issues, in the way that it's becoming this hot button global issue to try and advance an incredibly conservative brand of politics. And you're seeing a lot of alt-right pundits on Twitter in South Africa, like Nodachos and Roman Kabanek and people like that, who do have a considerably large platform of listeners and people that listen to them and take their word as the Holy Grail, kind of advancing this idea that transness is woke ideology, and, you know, having demographic data that shows, well, you know, it's not these wokies you're so scared of. It's actually, you know, a lot of working class people, Black people in South Africa that tend to be trans. Like, that is kind of the reality that we don't get to speak about, because all of the people that, get the attention for being trans on the internet in South Africa tend to be white, tend to be wealthy, don't tend to be from, the demographic groups in which we largely do exist. And, having data lets us show, hey, it's actually this broad social problem, and it's not just rich white ladies in Camps Bay getting, design drugs and stuff like that. Which is a weird tangent I went on there. I do apologize. And including queer people in social surveys just means that we get to be included in society, in local, provincial, or national policy decision. It has a life-saving purpose, particularly when you look at the public health perspective of ensuring that we have healthcare that caters to everyone. But if we, if I latch on to Anthony's example of education, it's a really good example from the US of the CDC's youth risk behavior surveillance system, which they only added questions about queerness and gender identity and stuff like that to a survey in about 2015, which after they did that survey, they published a landmark report that kind of outlined the public health risks specifically experienced by queer learners in schools, noting this immense disparity between non-queer and queer students, where there's disproportionately higher risk of suicidal ideation, body dysmorphia, the prevalence of issues like bullying. And this allowed a lot of state agencies to address these disparities by implementing more inclusive anti-bullying policies, ensuring that their health classes are more inclusive and relevant to queer students, and just easing students' access to healthcare providers. And if we are to contextualize this to South Africa, particularly to the most recent spate of suicides of young queer learners, which I have covered to an extent, having this kind of data allows us to better prevent things like this, because we're able to make estimations of the suicide rates and employ anti-bullying policies. We're able to know actually just how many queer teens there are, so we can better ensure that our educators are trained appropriately. And I think that's my signal that my time is up. Okay, then if I just have one last thing about what you should take away from this is the importance of statistics to drive necessary conversations. We always talk about the need to have conversations about queerness, and data is a kind of conversation. It speaks to an intersection of social determinants like race, class, gender, and mobility, and allows us, especially journalists, to put forward stories that challenge the status quo, that inform people better and allow us to have a better understanding of the lived experiences of queer people in South Africa. And thank you very much for the time. Thank you.
Thank you so much, Cassandra. That was a great contribution. And we are reminded that although South Africa became the first country in the African continent to legalize LGBTIQ plus rights, we have a good document of the Constitution, but sometimes those things that are written on the Constitution, we don't see them in reality. So thank you so much, Cassandra. I will now call upon our last speaker, Neo Nghenavo, who is a director of gender and marginalized groups at Statistics South Africa.
Thank you very much, Stembiso. Thank you very much for inviting Status A to be part of this initiative. As Status A, we are still in the initial stages of this research, and therefore this provides us an opportunity to move along with the collective. And maybe just for my opening remarks, as Status A, we share the same sentiments as what the previous speakers have shared. And going back to the context of the LGBTQI community in South Africa, we know that they are being subjected to discrimination, exclusion, and human violations, and they are mainly targeted for crimes. And we know that we do have progressive laws in South Africa. The Constitution, for instance, prohibits the discrimination against individuals based on their sex, gender, or sexual orientation. And again, going back to the development agreements that we have, we know that the SDGs as well talk to the principle of leaving no one behind. Therefore, including the marginalized groups like the LGBTQI groups. So, however, what we are seeing that despite all these laws, we still have large data gaps. And therefore, what we are missing is that we really need to have statistics to inform and to guide development and policies for understanding the profile of the LGBTQI community in relation to their physical and mental health, in relation to the education outcomes, in relation to housing and employment patterns, and also including the ability to participate in civic institutions and other development outcomes. So why do we say we need these statistics? I've already mentioned about the one of informing development outcomes. Also, we also need the statistics to be able to identify the impact of the stigma and prejudice on development outcomes such as safety, income, education, health, family life, violence, and migration. We also need to be able to evaluate the effectiveness of government and civil society programs that are meant at advancing the lives of the community. And also we need to assess the government efforts to respect, protect, and fulfill the human rights of sexual and gender minorities. So what is the current status? I think the previous speakers talked to the lost opportunity in census. What we are saying as Statistics South Africa, we are saying that we have not yet implemented the direct questions to measure SOGI in our surveys and censuses yet. Even though when we were doing the census consultation processes, our engagement with the stakeholders revealed the need for the demand for this data. However, we felt that for the census, that could have been not an opportunity or the possibility for including this, because we know that there has to be thorough testing before we could implement any questions in the census. And as a result, we decided that for the census, we can not include these questions, however, go back to researching. That is why we are saying we are still in the initial stages for this. Other issues that informed this decision was that we know that sexual orientation and gender identity are complex and multidimensional issues that pose a number of challenges for data collection and measurement. In South Africa, we still do not have uniform definitions for SOGI concepts. And again, we know that there are those populations that are hard to reach populations when it comes to enumeration or data collection. So sexual and gender minorities are one of those hard to reach populations. The other important issue is the fact that individual questions which could help to identify issues that are related to the hard-to-reach populations, is that it may be difficult to collect, especially in household surveys, as these surveys are based through proxy responses, where one family member responds on behalf of the entire population. As we know that some of the questions related to gender minorities are sensitive. Okay, yes, is there someone? Okay.
Sorry, you can continue.
Okay. Can you hear me?
Yes, yes.
Oh, okay. Okay. In addition to that, I guess one of the speakers also talked to the fact that the traditional beliefs and stigma associated to the SOGI population usually leads to refusals during data collections. Therefore, if we are to implement surveys or any data collection instruments, we will need to ensure that there has been a thorough testing and also an appropriate instrument for collecting such data is in place. So what could be the roadmap towards collecting SOGI data? Therefore, what is needed is defining the need, and the need is there, it has already been defined. There is a demand for data for SOGI. What we have to do now is to move towards conceptualizing what is to be collected. And this has to be done through consultations. And we have to evaluate which questions are to be included. We have to test, we have to define the methodology, and while also ensuring that we adhere to international standards, and also ensuring that there is comparability of data over time. So the core purpose of a survey will have to be clearly defined, and we also have to consider the effect of the length of the questionnaire so that we ensure that respondent fatigue is avoided, and also ensure that we collect quality data. Okay, I have also mentioned the issues around the stakeholder engagement. So this are going to be important issues to be considered for any implementation of a survey. We have to ensure that all the organizations that have previously dealt with LGBTQI communities and their collection of data are thoroughly consulted. And then we also have to ensure that there is harmonization of the concept and definition. This is very important in order to ensure that we are achieving or improving comparability of data of data over time, and also ensure that once we collect it, we are able to do trend analysis and track progress over time. So the other important issue is training of the field workers. We talked about the complexity and the sensitivity of SOGI data. Therefore, we will require to have an extensive fieldwork training. Field workers are to be trained in order to ensure that there is no influence of estimates or any data collected. They have to be trained. We should ensure that they understand the definitions, and also ensure that we train them on different strategies for fieldwork, and also creating an environment that is conducive for disclosing sexuality information. Yes, thank you very much. That is it from my side.
Thank you very much, Neo. It is amazing to hear that StatSA do acknowledge the need for SOGI data, and I'm also happy that StatSA is planning to implement these questions on the surveys and the census that you conduct. I know there are complexities in terms of language use and categories that are used in most surveys. So in this seminar series, we're trying to sort of determine the scope of restructuring the research designs and the research instruments so that we'll be able to observe the presence of LGBTIQ+ individuals within the population. So thank you so much to all the speakers for their contribution. We do have a number of questions on the chat box. We only have 22 minutes for the rest of the discussion. So I'll just take us through the questions and then the speakers will respond. So the first question is from Vuyiswa Kwanazi. And the question is, how does one ensure the safety of the LGBT plus community when they are recruited as participants or co-researchers during data collection, particularly those who may not have come out? Okay, that's the question. How does one ensure the safety of LGBT community when they are recruited as participants or co-researchers during the data collection? I'm not sure if this question is for the speakers or is something I can also answer. Do you want to come in, Professor Brown?
Thank you for the question. I think that is a very important question. I'm thinking particularly also with young people who might have embraced their identities at school but are not out in the home environment and could put their well-being at risk when we have to collect this information through research or even through image platforms and tools. So one of the things that I would strongly suggest, and what we have used in the past, considering this concern of safety, was the lessons we have learned from COVID-19 and the online platforms. And perhaps our participants do not have to participate in person. Their identities do not have to be disclosed, hardcore disclosed, as a face-to-face engagement of data collection. But what alternative tools are there, such as online platforms, online surveys that could be provided. Recently with Access Chapter 2, I think during COVID, we collected large data, about 3,000 participants on a study that had to do with conversion practices. And it was able for us, we were able to collect this data through various online surveys. So that is one way. A number of participants, we had to provide them with the data. We had to give them tokens. If they did not have the devices, they could go to internet shops and so on to access these kind of research activities. For others who did not take part through an online, we would do telephonic participation. And so there are alternative ways in which the safety can be secured. I was thinking as this question came through, how would I want to deal with this in a schooling context? And I was just wondering, how would an anonymous survey be considered, and that it be placed in a different box whenever a student, all students are then completed with that kind of survey as they submit the application forms or so on, that it doesn't have to disclose their details, but it can be anonymous and there's a separate place or container where this can be placed in. But I do think there are alternative ways in engaging with data collection for vulnerable communities who are at risk of safety and well-being. Thank you.
Thank you, Anthony. Can I just ask everyone who posted the questions to just ask the questions verbally instead of me reading them? Because some are a bit long and maybe they can just try and shorten them when they ask verbally. So the next question is from Tara. Tara, can you please just come in and ask your question?
Oh, thank you. I mean, I think it's not so much a question, but it is a comment about, and I think Anthony addressed it to some extent, that yes, in surveys there are many ways of doing these things anonymously, which doesn't then obviate the point that I think Neo raised, which was so important, is that the challenge is what you ask in ways and in language and in concepts that are generally understood, have shared definitions, etc. But in administrative data forms, which is so important, and I completely agree about the incredible importance of the opportunity of administrative data collection. So, you know, any kind of form where you fill in and you get asked to check a box, male, female. There you have a whole range of other questions about the acceptability and anonymity and safety and the implications of admitting to not be binary in an administrative context, which could then exacerbate discrimination in a system rather than enabling a slower process of advocacy to counter that kind of discrimination. So, I mean, I think what's really interesting to me in this conversation is that the sort of back and forth between we need the data in order to reduce discriminatory societal attitudes, but the discriminatory societal attitudes make it hard to collect the data in a way that we think will be reliable, because many people might not be willing to identify as queer in various ways, out of fear, out of worry, and then you get data that underrepresents the actual population, etc. So I don't know if it's a question, but I mean, I guess it is a sort of, well, it is a question to the speakers. How do we break that worrying cycle of getting the data, but in a way that then hopefully doesn't underrepresent, so that we don't then shortcut our advocacy work? Pierre's comment of like, well, you know, and Julia's comment, what if we do this data collection, then it turns out to be a really small number, and then we get told to go away. Thank you.
Thank you, Tara. Yes, you can come
Yeah,
in.
I think I will take that one. But if you're looking at something like the trans community, there's almost going to be a kind of assumption that the number is going to be incredibly small, because that's just, you know, the kind of statistical trend of the trans populations make up very small parts of the respective communities. And there's definitely an argument to be made for like important ethics of codes of how you do the data collection. And even if the number is small, we shouldn't be creating an administrative system where we kind of go, oh, there's only 5% of the population is trans. Oh, well, we can keep things as they are. We need more targeted information to understand where the gaps are with our service delivery, and how can, now knowing, you know, there's X amount of trans people that live in rural areas, how can we then use that to create policies that push for more accessible resources in those areas? And it's definitely a very delicate balance between, you know, the funding of providing these resources and ensuring that there's, you know, accessible healthcare and accessible services for everyone, and trying to target the widest group of people possible. But if there's already a failure in the service delivery as it currently exists, without any data, the only kind of hope we can have for improving service delivery is to have data to understand where those disparities are and where those gaps exist, and kind of implement something that allows us to just better advocate for LGBT rights, particularly for trans rights. Yeah, it's a difficult and long conversation that we are going to need to have, but the ultimate outcome can't really be to be cynical and kind of shrug our shoulders if there's not enough data to support what we want to do. It's still necessary information to have, and that's just kind of my 2 cents. Yeah.
Thank you, Cassandra. And I believe some of the questions that are coming up today will be answered as we continue with the seminar series, because we'll cover some of the issues on those sessions. Neo, do you want to come in?
Embi, can I just quickly make a contribution to that last comment?
Okay.
The concern about large numbers. Large numbers actually frames the extensiveness and the vastness of the service that we need to render. But no amount or no number should determine whether a service would be delivered or not. I think our colleague from State South Africa made it very clear to say that every citizen matters. And this is because of the constitutional promise of care, support, and affirmation. It is not determined whether we have 5,000 or 500,000 trans-identifying individuals, but it has to do with the issue that in a particular area, what does it look like in terms of service delivery? Are we catered for certain identities in policy and so on? So large numbers should not be read as the determining factor for service delivery. Another last aspect that I want to bring in here is the aspect of language. I have collected tons of qualitative research in this field. And when I worked with the elderly, when I asked the grandmother, so your son identify as gay, she said, don't call him gay. He's my fana boy. And so language is a very important one because our data collection will not only be with SOGI's identities, it will be with the larger population of South Africa. And how do they understand, interpret, and engage with language, terminology, and identity references? And that is something that our colleague has mentioned, that we need to be critically conscious when we develop tools of data collection. I really want to encourage us as we think of this, that this is not a straightforward, let's go to State South Africa and they pull together a survey tool. But language is absolutely fundamental for this process. And it could either create an enabling data collection process, but it could be debilitating and it could fuel issues of further discrimination. Thank you.
Thank you, Anthony. Neo, do you want to come in?
Okay, and oh, oh, wait a minute. Okay. Okay, I think another point that is halfly covered is the issue around the risk of confidentiality of information. I believe the community we are dealing with, we can consider them as, or it's a rare event. And at times when we thinking of nationally representative data and the disaggregation of data, even to lower levels, there could be risks for for the confidentiality of data, say for instance, for other socioeconomic indicators. Yes, when it's just the count, I don't think it is a problem. But as we go down to other indicators, which could be of confidentiality, like your income and other poverty status, those are things that we should also consider, especially when we thinking of the tool that can be used to collect such data. Thank you.
Thank you, Neo. Pierre, would you like to also come in just to add on what you asked on the chat box?
Thanks, Nbiso. I'm really enjoying this conversation. And I think I can see that some of the comments will also are bleeding into some of the topics for the subsequent seminars. I'm mindful that today's focus is on why is it important to collect this data in the first place, and what are the risks of not collecting it. But I'd just like to acknowledge the difficulties in the school space. Some work I've done around transformation and diversity and inclusion, has shown that, for example, some learners identify as trans or non-binary, but their parents either don't know or are uncomfortable with their child adopting those labels. And so collecting data in that context is quite fraught sometimes. So to the point of the size of our communities, I think there's quite a rich discussion in the chat about that it's not so important that we enumerate, although that can have its usefulness, but more how are we impacted, as Julia suggested, for example, by homophobia or transphobia. So if we can show that queer learners are subjected to a disproportionate amount of bullying in a school context, that's important, not the number of queer learners, but the fact that they're overrepresented in bullying in the school context would be, for me, quite an important thing to know. So I think it's more just a comment at this point, Stevie. So thank you.
Thank you, Pierre. Julia, would you also like to come in just to add? Time is against us. So
thanks, Nbiso. I don't think I have a whole lot to add. Others have already spoken very eloquently. I think perhaps the one question for me, which is probably for a later seminar, is around sort of the balance between planning and preparing to ensure that you're collecting high quality data versus getting started so that you can learn from the process of starting. And yeah, I'd love to hear others' thoughts on that as well.
Thank you, Julia. Is there anyone who would also like to add something before I wrap up? Okay, I'll just assume that's a no. Okay, we have 4 minutes left, and I just want to thank everyone for joining us for the first edition of our seminar series. And it's been a great conversation, and I hope people will continue joining in for the upcoming sessions. So in 2 weeks' time, we will have the second edition, which is on capturing the complexities of the entire population. And we'll be looking at how to ask about sex, gender, and sexuality. And we'll also look at the ethics around asking about SOGI questions. And we'll also look at the relationship between legal status and self-identity. And also just looking at the inclusion in terms of population studies and the role of local naming systems in framing the world as binary around biological sex. So yeah, thank you so much, and huge appreciation to our speakers for their contribution today. And we will see you in 2 weeks' time on the 28th of October. Thank you.
Thanks, Barin.
Thank you.
Thanks, everyone. So
everyone.
nice to start this.
Yeah.
Everyone.
Stimbiso,
Yes, Pierre.
should we have a brief debrief? Do you have time for that?
Sure, I do.
Okay, I'll
Yes,
wait.
please. Colleagues, or maybe we close the session and the recording, and then